It's time to take humor seriously. And seriousness humorously, to quote Steve Behrman, aka Swami Beyondananda. So we've all heard laughter is the best medicine. But is this just a nice sounding adage, perhaps an old wives' tale, or is it truth hiding in plain sight? And more importantly, how is laughter going to help you if you have cancer? Well, we are going to be touching on just that. Actual research studies on laughter, what happens physiologically in the body when laughing, stories of people on death's door who healed themselves with laughter, philosophical perspectives on humor as an enlightening perspective, and touching on the Jester archetype, how people are employing prescriptions of laughter, the difference between laughter from humor versus laughter for its own sake, and more. So, hi, I'm Dr. Lisa Matejka. I am a cancer transformation guide, naturopathic physician, energy worker, transformational life coach, and I help those with cancer and navigate their inner journey to awaken and realize their own healing power and potential on all levels, physically, mentally, emotionally, energetically, and spiritually. Okay, I absolutely had to take that nose off. It was pinching my nostrils shut, making it very hard to breathe and very annoying. But I'll keep the wig on for you all. Okay, so one of the very first modern day famous examples of someone who used laughter to cure themselves was a man named Norman Cousins in 1964. He was diagnosed with ankylosing spondylitis and given only a few months to live. Ankylosing spondylitis is basically a crippling degenerative condition of the spine. And he decided that he was either going to cure himself laughing or laugh his way to the grave. So he checked himself into a hotel, rented boatloads of comedic sitcoms and movies. I think it was like Marx Brothers at that time or something. And he not only allowed himself to laugh naturally, but he assisted it and enhanced it with deep belly laughing until his belly hurt. And about only 6 weeks later, he was in complete and total remission. He later published a book, The Anatomy of an Illness as Perceived by the Patient. And this was actually credited to be one of the first, if not the first, but at least one of the first books that actually was about taking charge of one's own health. And people were very inspired by this, and they actually started working with their doctors, or at least getting the approval of their doctors, on this therapeutic modality called laughter. But this is by far not the first time laughter has been employed to cultivate resilience to a dire circumstance. Viktor Frankl, famous psychologist that was in a Nazi concentration camp, made a pact with a fellow inmate of his to find something to laugh at every day, and they did. He later wrote the book as a survivor, A Man's Search for Meaning. Now to a more recent and perhaps relevant example involving cancer specifically, we come to, I believe it was the 2000s, Roz Ben Moshe. She was diagnosed with colon cancer, and the only conventional treatment she did was surgery. Now, after the surgery, she literally could not laugh because the surgery. So what she did was she sent smiling energy. That's right, you can do this. She sent smiling energy to the parts of her in pain, also practiced gratitude and journaling. And then when she was physically healed enough to laugh, from the surgical incisions, she then employed all types of laughter therapy. She basically was already familiar with laughter as a therapy before her cancer diagnosis, and then it gave her this really unique opportunity to actually put it into practice and test it for herself personally. There is an officially documented case study done on her, and she published 2 books, Laughing at Cancer and The Laughter Effect. Her basic overall conclusion is that a laughter mindset is an important tool for overall well-being. It can help social health by building connections, reframe negative situations, thus building resiliency to stress, and helps us gain mastery over situations we otherwise can't control, but we can always control ourselves. And believe it or not, we can control our laughter as well. I'll get into that in a little bit. So what exactly does laughter do in the body that facilitates healing? Well, it creates an alkaline environment, interestingly enough. So this is a common naturopathic therapeutic target, is to have less of an acidic environment, more of an alkaline environment. So laughter does this. And as we know, only in rare circumstances can disease exist in an alkaline environment. Laughter also happens to increase oxygenation, and increased oxygenation also happens to be a common naturopathic therapeutic target. So, and it does this in a couple different ways. Laughter itself is an aerobic activity. It works out the diaphragm and increases the body's ability to use oxygen as well as creating it. It's great. Laughter is great for heart health. It decreases blood pressure. It decreases stress hormones like cortisol. It increases feel-good hormones, endorphins, oxytocin, dopamine, that sort of thing. Did I say it decreases pain tolerance, or it increases pain tolerance, decreasing the feeling of pain. It does a lot of stuff. Oh, did you know that when hearing a joke, it actually activates the same parts of the brain as when your brain solves a problem, which I guess in a way makes sense. So it's good for brain, cognition, and health. Laughter activates the immune system. It does this in numerous ways. It increases the number and activity of natural killer cells. And as we know, natural killer cells are vital for fighting cancer. It increases the number of T cells, that is activated T cells, T lymphocytes. It essentially activates them. It increases gamma interferon, which activates the immune system. It increases antibodies such as IgA and IgB, those immunoglobulins. The B one is the most prominent one in our body, and immunoglobulin A is commonly for respiratory tract infections and other infections. Laughter also increases complement C, which is a component of our immune system that helps antibodies to pierce dysfunctional cells, which we of course want to do, and cancer cells are dysfunctional cells. And yeah, so it really does boost the immune system. And laughing makes you feel good. As we've discussed, it increases those feel-good chemicals, the endorphins, the serotonin, the dopamine, the oxytocin. It decreases the stress hormones, cortisol. And when you feel good, you feel good. When you feel better, you get better. And think about the funny people you know and the more sort of angry people you know. Who's healthier? So now we'll get into some research studies. There was a very recent one done in 2023, and not just any research study, this is a compilation. So it's entitled Laughter as Medicine, a systematic review and meta-analysis of interventional studies evaluating the impact of spontaneous laughter on cortisol levels. So essentially, this is a compilation of 8 studies. 4 were randomized controlled trials, 4 were quasi-experimental, which just means they weren't randomized essentially. And it was specifically looking at the effect on cortisol, and each and every one of those studies decreased cortisol anywhere from 32 to 37%, which is very significant. And think about stress. We now know it is, if not the cause, it is definitely a factor or an obstacle to cure for so many diseases, and cancer is no exception. We now know that when someone has cancer, making sure they have good stress management techniques in place is vitally important. And so I thought it was interesting, what types of laughter therapies did they do? Because if we're gonna model this, then we need to know exactly what they did. So 5 of these studies, the laughter came from watching humorous videos. 2, the laughter came from working with a trained laughter therapist. Yes, these do exist. And 1 was a self-administered laughing program, which we'll talk about ways in a little bit of how we can sort of laugh with ourselves. So, the first systematic review and meta-analysis done on laughter was actually in 2019, and it involved 86 studies for the systematic analysis and 29 studies for the meta-analysis part, total of like 115 studies on laughter. That's how many existed. And these were from all around the world too, so across many different cultures. And of those 115 studies, 8 were specifically just laughter therapies on cancer population, which is actually a good amount when you think about it. The fact that there's 8 studies at all on cancer and laughter is pretty good. And so the conclusions of all these studies, the overall conclusions, and yes, and the 8 studies on cancer showed, each of those showed this as well. Decrease, and this is all of course statistically significant, decreased depression, anxiety, stress, improved mood, life satisfaction, sleep quality, respiratory function, pain, immunity, perhaps some other things too. I think that's it though. And the cancer studies themselves were the strongest for improved stress, depression, anxiety, and mood. So pretty cool, I'd say. So in the newer field of psychoneuroimmunology, which basically studies the interconnectedness of the immune system, the brain, and our psychology, shows us, we know now, that non-physical things like thoughts and emotions have an effect on our bodies at the cellular level, even as much as genes, lifestyle, and medicine. That is huge. And so it's concluded from this field of psychoneuroimmunology that thoughts, emotions, and attitudes do affect the course of cancer, and specifically the recovery from breast cancer. Most of the studies with cancer are breast cancer. So yeah, and what can affect our attitudes, emotions, mood, and thoughts like humor and laughter can? I recall this study from long ago, which studied and essentially measured laughter in people. And it concluded something similar to kids laugh about 300 times a day, teens laugh about 30 times a day, and adults laugh about 3 times a day on average. My fellow adults, you should now be convinced that you should laugh more. So now the question is, how? How? Well, normally I wouldn't propose TV, but it is a good idea to watch TV if you are going to watch funny things. Watch your favorite comedian from any time era. If you don't like the ones from this era, you could watch recordings from old ones. Not just comedians, but funny sitcoms or comedy movies, silly things. There's even funny books. Back in the day with newspapers, there was the funnies, the comics. Let's see, you could play with your kids, grandkids, nieces, nephews. I guess kids are pretty funny and silly, so that can help. Pets as well can be really cute and funny. Hang out more with your funny friends. Really just allow yourself, give yourself permission to be silly and funny and go seek it out. But with a sigh of relief, laughter doesn't have to come from something funny. We can actually train ourselves to laugh on command even if something isn't funny. And guess what? The body doesn't know the difference. And this is a theme we keep coming across. The body doesn't know the difference between what you're thinking, feeling, and what's real. So our initial resistance to this is going to make it hard. It's going to seem, if you force yourself to laugh, yes, it might seem at first forced, silly, ridiculous, because it seems unearned, silly. It just seems weird. But like with anything, the more you do it, the more natural it becomes, till it's like, oh, was that even a forced laugh, or was that a real laugh? Interestingly enough, the 2019 meta-analysis I mentioned before, the big one, the first one and the large sample size one, it actually concluded that non-humorous laughter had a larger effect than humorous laughter. Why? I don't know. It doesn't exactly say, it doesn't exactly know either. My own personal theory is that, when we naturally laugh, do we always really let ourselves laugh? Whereas if it's like sort of this intentional laughter, it might be more hearty, so to speak. Anyways, intentional laughter, so non-humorous laughter is also known as intentional laughter. It's also known as simulated laughter, and humorous laughter is also known as spontaneous laughter, just so you know. So the cancer survivor from earlier, I mentioned Roz Ben Moshe, that cured herself with laughter. After that, she did even more research on intentional laughter, which, like I said, is also basically the forced laughter, the simulated laughter, the non-humorous laughter. She did more research on this herself, and she researched something also called laughter yoga, which is basically a form of intentional laughter. It involves groups, it involves eye contact, deep belly breathing, laughing in sounds like ho, 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 ha, 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 chanting and clapping. And it's found to have a very powerful effect. And there's other techniques if you don't like that. If there's some initial shyness and you don't want to get into a group, then there's something she invented called at least I think she invented it, called the laughy, kind of like the selfie, but it's called the laughy. And what you do is you take a little video of yourself laughing, as hysterically as you can, and then you play it at times throughout the day and you laugh along with it. I know it sounds silly, but hey, if we're really going to take charge of our health, don't we always kind of have to go the extra mile and do stuff? So why not give it a try? But yeah, sort of the mantra of, not literally, but sort of the mantra of laughter yoga is not needing to be happy to laugh, but laughing to be happy. And that's essentially what intentional laughter is. It's not waiting for something funny to happen to laugh. It's just laughing for the sake of laughing. So there is always a way, my friends. Laughing is innate, primitive, and instinctual, but the practice of doing it regularly is a choice and a habit that may need to be formed or enhanced. So if you can't laugh, smile. Even smiling, you could call it forced smiling, triggers some of those same endorphins that laughing does. And these neurochemicals are, of course, healing as well. So forcing yourself to smile, at least for me and many others, just that act alone feels better than not smiling. But again, it's one of those things. The more you do it, the more natural it becomes, the better it feels. So why not try to just smile more throughout the day? Smile at others, then they'll smile at you, and that actually might make you smile genuinely. It's a beautiful thing. And there are actually many energy worker techniques. I shouldn't say many, but there are some good energy worker techniques that involve smiling, and there's guided meditations that do send smiling energy to yourself and to the world. So this is a real thing you can try to start to employ. Energetically speaking, you could say spiritually speaking, laughter changes the energetics, the energy field. It naturally allows for a more allowing state and not a resisting state. And although this is a bigger topic than this video, that is essentially the key to healing as well as where the path of enlightenment goes. It's about letting go, surrendering, accepting, not resisting, not holding these things, getting them stuck inside of us, but instead allowing things to pass through us and to not get trapped, which trapped energy creates all sorts of problems. Does that make sense? I just can't get into it too much, but I think you all understand. Let's talk about the Jester archetype, just briefly, because the archetypes can be a whole lot of convo in and of themselves. Perhaps you've heard of the archetypes, though, the four main ones: the warrior, the magician, the lover, the sovereign, aka king or queen. But there are a few others, including the jester, which may also be known as the fool or the joker. So the jester archetype is cousin to the magician and is typically on the sideline cracking jokes. He's able to detach from emotion and see things from a wider perspective that allows to not be so serious, but to see things from a lighter, more comical perspective, but also not being so in something, but being kind of a more bird's eye view of something. That detachment also allows him to see some sort of things that other people might not see. Therefore, the jester is actually not as superficial of a character as many tend to think, but actually quite deep and philosophical, seeing past people's phoniness, seeing right into people's flaws and fears. And perhaps that's where some of the jokes come from in the first place. His jokes and antics are able to relieve tension, relieve pressure, which can be very healing in itself and prevent potentially bad scenarios. And also, their jokes and merriment can shine light on a hard truth that may not be ready to be heard outright just yet. I actually have known cancer patients that have joked about their cancer, that have even joked about it with their family members, and this is while it's happening, not after the fact. You know, of course, it's select family members that share that particular sense of humor, so it definitely can be done. Of course, the flaw with the jester archetype, if it goes too much in one direction, too much detachment, can be seen as a callous. But I think we can all agree there is something to be said about having a healthy detachment where you're not just reactive with emotion, but able to see things from a broader perspective. And sometimes it actually just is kind of funny. The jester archetype allows us to not be sucked in, not be pulled downward, but to be able to see the merriment in all things as well as the deeper truth in all things. We've been shifting a bit into more esoteric themes, so I will touch on sort of this one last thing, the law of attraction, which of course is whatever you vibrate at is what is magnetically drawn to you. So what you vibrate at is your energetic state, your energy field, which is made up of your mental, emotional state, you know, thoughts and emotions. And so that's going to bring like things to you. So why not be in a good mood then? It seems like that would be the way to go, feeling good, bringing good things to you. If you're in a really dark place, that really could be a sort of downward spiral. So a lot of people do employ this. If you pay attention, most of the super wealthy elite people, they do believe in this. If they get quote unquote bad news, they will go on vacation, they will go have fun, they go to a comedy club. It's really important to maintain your energetic state. Of course, you're not going to be super happy all the time with a cancer diagnosis, but all I'm suggesting, and because positivity is so much more powerful than negativity, you don't have to be positive all the time, but give yourself time every day to lighten up your energy field. Go to a comedy club once in a while. Put on that funny comedian to listen to while you're doing house chores or driving or whatever. Whatever the case may be, whatever makes you laugh, whatever makes you smile, whatever makes you feel good. It is so important to do that every day. It doesn't have to be all day, every day, like I said, but take the time to do it every day. My friend, are you convinced yet that laughter is indeed a powerful medicine, not only physiologically, but mentally, emotionally, even energetically and spiritually? Which which are all connected anyway, and it's free, a free modality. Of course, it does require some conscious effort, but all things in life that are worthwhile do. So, which will you incorporate? Will you make it a point to watch more funny stuff on TV, perhaps trading in some of the stuff you currently are watching? If you're watching the news, definitely trade that in for some humor. Or maybe you do watch funny stuff on TV. So I invite you to step it up a bit. Will you try the Laughy? Will you set alarms on your phone sporadically throughout the day to remind you to laugh for no reason? Will you seek out a trained laughter therapist or laughter yoga instructor? Will you hang out more with silly, light-hearted, funny people and let your humor out? Will you simply remind yourself to smile more? I hope you find something. And remember, it is a choice to take things so seriously in life or not. And I'm not done yet. I have a free gift for you all. Just click the link in the description box for my free ebook, The 10 Common Healing Factors Among Cancer Survivors Who Beat the Odds. This is based on decades of research by Kelly A. Turner. Yes, specifically on cancer patients. Yes, and they all had spontaneous remissions. But what were the 10 things they had in common? That is what you'll find in the article, and it just so happens one of those is increase positive emotions, where they consciously did things daily to increase their positive emotions, which is very much in line with everything we talked about today. So, with that being said,